Hi, my name is Rio Calvert and I'm a nurse practitioner in Orange County, California. I've been in aesthetics for 15 years and I've been doing thread lifts for 5 years. It is a game changer for my patients, and today we're going to be discussing threads. Okay, so there's two types of threads. There's barbed threads, which are the lifting threads, and then there's monofilament threads, which are also called smooth threads. Today we're only discussing smooth threads. Now the smooth threads are much easier to insert and they don't require as much skill. The barbed threads are a little bit more complicated, does require a little bit more technique, but today we're going to be discussing smooth threads and the purpose of smooth threads and where we can use them. Inserting mono threads are very easy. They're basically these little hair-like sutures on a needle, and you're just going to place it underneath the skin. Doesn't take virtually any time at all. There's very little downtime, and there's very little risk. It basically is a suture. Sutures have been around for a very long time, and your body absorbs them over time, breaks it down to simple sugar. Within the mono thread family, you have smooth mono threads, and then you also have twisted mono threads. Both of these have a fantastic ROI. Basically, how you want to figure out your profit margin is look and see how many threads are you going to use, and then maybe double or triple what you will charge a patient for it. Mono threads are easy to integrate with other modalities in your practice. They will work synergistically with your IPL, with your microneedling RF. They'll actually work together to help stimulate collagen and get a longer lasting, better outcome. Okay, so this is a basic setup of your tray. We want to have a clean environment. It doesn't have to be sterile, but we want it as clean as possible. We want to have some kind of an antiseptic, whatever it is that you use in your practice. This is Hibiclens and some alcohol, some non-woven gauze. I have a tongue depressor here to apply the topical numbing. This is a 1 ml syringe with a 32 gauge needle on it. This has straight Lido with epi, and that's going to be used to make my entry point with my introducer. I have an 18 gauge needle here, which will make my port. White eyeliner, or you can use markers to create the lines and the vectors that you're going to use to insert the threads. And then I have the threads I'm going to use for the procedure. A tip here is to go ahead and pre-release this cap so that they're easier to grab and insert into the tissue once you're ready to begin. So I go ahead and I release all these prior to the treatment. Okay, so we have applied topical numbing to our patient here. We're going to go ahead and leave the numbing on her décolleté because we're going to save that for last, and we are going to be treating her face. I'm going to clean everywhere because we're going to be using our needles in our marionettes, our nasolabial folds, back here in the preauricular area. So it's really important that we clean everything very thoroughly. You can use Puricin, you can use Hibiclens, you can use alcohol, whatever you typically use in your practice. It's just important to really get that skin as clean as you can all the way to the hairline. And it's very rare that you're going to get infection. That we really haven't had any infections with this particular procedure, but it's also very good to practice good cleaning technique. Now we're going to do a facial assessment. What bothers this patient is the under eye hollows, her nasolabial fold, her marionettes, pre-gel sulcus, and the preauricular area. We're going to be using a multi-specialty thread in the nasolabial folds, marionettes, and the pre-gel sulcus and the preauricular area. And then under the eyes, we're going to be using a blunt tip thread for the under eye hollows. What this means is we're going to make maybe 1 or 2 entry points per area and be able to put multiple threads through each hole as opposed to having multiple holes put into the patient's skin. Prior to numbing the area, we need to measure where we want to begin inserting our thread. So what I've done is I've determined where I want my thread to end, and I need to make my injection with lidocaine right at the base where I want to insert so that it will end up in her nasolabial fold. Same with the preauricular area. I want my entry point to be back here so that I can have the bulk of the thread be where she has the most volume loss. So now I'm just numbing my areas where I'm going to be placing my port. So straight 1% Lido with epi. You want to allow for time for the numbing to take effect. And what we see here, we see a little bit of blanching and we're getting some vasoconstriction. That will help with reducing the amount of bleeding that you get in the area, but it also, once it's blanched that they aren't going to really feel anything. I'm going to use an 18 gauge needle to make my entry point. Go ahead and turn away from me. I'm going to tap, tap, tap. Do you feel that?
No.
Okay, and then it's just a little poke right into the dermis. And we just want to pause and let everything kind of just settle down for a second. And did you feel that?
Very little.
And then we just go ahead and remove our needle. And I apply pressure in the event that there's going to be a little bit of bleeding. That way I can reduce any bruising. Okay, good. Let me use a little bit of my Hibiclens here. Now, once you've done that, if you don't get any bleeding, it's almost impossible to find the hole. So you can, if you want, leave the needle in there before you insert your thread, but we can see a little bit of blood there. Now I'm going to go ahead and I'm going to make sure I know where I want to end up. I'm going to insert my cannula underneath the skin. It's going to feel very, very easy to insert. If you're in the wrong plane, it's going to be difficult, but you can see where I'm at. I'm just going to be a little bit more superficial, and we're just going right up into the nasal ala, all the way up. Once you're all the way in, go ahead and give it a little twist, pull, and release. And now we have a multi-specialty thread in the nasolabial fold. It's going to help stimulate collagen and pop that area up. We can put multiple threads in that area. So we can start to see that we've already raised a little bit of that nasolabial fold. I'm going to go ahead and put another multi-specialty thread. This thread is basically 18 threads in one. So I'm able to get right now 2 of these in there, and it's almost as if I've put 18 times 2, 36, okay. These threads are basically 18 threads. So I've already put 18 threads in there with just one entry point, and I'm going to put another multi-specialty thread, 18 threads again, in the nasolabial fold and help pop that up. We just want to be right underneath the skin. I'm holding that skin taut a little bit to allow for this thread to insert smoothly into the nasolabial fold. Are you feeling that?
A little bit.
Okay, and then I twist 360 degrees, and there we go. And we can already see that that nasolabial fold is starting to pop up. Okay, turn towards me. All right. Now we're going to go ahead and insert a multi-specialty thread into the pre-gel sulcus. I'm going to make my entry point with an 18 gauge needle. I've already numbed the area. We can see that it's blanched. And here we go. Do you feel that?
No.
Okay, just a little poke. 1, 2, 3. Okay. We want the bulk of those threads, 18 threads right there, to be right here where her pre-gel sulcus is. So I'm going to go ahead and there we go. There we go. Just right underneath the skin, just under the dermis. I'm going to push it all the way through, making sure it's engaged. 360 degrees, and out we go. Now we're going to go ahead and fill in the pre-gel sulcus with this thread, the multi-specialty thread, which is 18 threads. And right here is where she has some deficiency, so I want the bulk of the thread in that area. So I'm going to come through my port here. I'm going to pull that skin taut. I'm going to stay a little bit more superficial, just underneath the dermis. A little bit of resistance is fine. You just knock, knock, knock on the door, and it'll let you through. Now it released, and I'm right where I want to be. Push all the way forward so that your cottonelle is touching skin. Go ahead and press down, rotate 360 degrees and pull it out. And now you've got a multi-specialty thread right in the pre-gel sulcus. With that same entry point, what we're going to do is go ahead and take another multi-specialty thread, and we're going to build up the gonial notch back here. We're just going to apply some, insert some threads right into the angle of her jaw to help enhance that and stimulate more collagen. We can even go up into the preauricular area as well and start to fill in that area. Okay, multi-specialty thread to go and fill in the gonial notch. Go. Twist and 360 degree out. There we go. Okay, so I'm just feeling for the facial artery, and runs right along here, this little notch. So I want to avoid hitting that facial artery. I do want to measure where I'm going to put my multi-specialty thread that basically is 18 threads. So with one entry point, I can insert 18 threads into this area and fill that up. So I'm just measuring to see where I want the bulk of the thread to be. And I'm just going to make a little mark here. And then I'm going to use my 1% Lida with Epi. And I'm going to avoid tattooing her and be just right in front of my little marking here and just do a little bit of Lido with epi just to get that nice and numb. Okay. I'm going to give that just a minute to blanch and help with that vasoconstriction so we're not increasing the risk of having a bruise. And then once it's blanched, we know that she should be pretty comfortable. I'm going to take my 18 gauge needle here and I'm just going to tap, tap, tap. Do you feel that?
No.
Okay, so I'm going to go ahead and insert my entry point. This is just my pilot hole where I'm going to be inserting the thread through. And I go ahead and I put pressure just in case there's a little bit of bleeding. Okay. Now, this is my multi-specialty thread. You can see that it's 18 threads, and what I'm going to do is I'm going to insert it and make sure that the bulk of those threads are where she has a deficit in the prejowl sulcus. I want to stay fairly superficial. We just want to be just subdermal. And when you're in the right plane, it's fairly easy to advance. Okay, and a little bit of blood is okay. If you don't make your pilot hole big enough, you can always go back in and make it a little bit bigger. Now, just going to be subdermal. I'm just going to go straight to the prejowl sulcus. I'm going to push that all the way. It should be fairly easy to push through, and it should be comfortable. Okay. There. I want to make sure I advance all the way. I'm going to take a 360 turn, pressure, and then I'm going to remove the cannula. Okay. And now we've just filled in that prejowl sulcus. So you can put multiple multi-specialty threads in that area to help build that up. All right, this is our multi-specialty thread. It's 18 threads. We're going to go ahead and go through our little entry point here, and we're just going to glide that right up into the nasolabial folds. I'm going to pull that skin taut. You just want to be subdermal. It should be fairly comfortable for the patient. All the way up to the nasal ala. I'm going to go ahead and press and 360-degree turn, and then I'm going to remove the cannula. There we go. That's one thread. Here's another multi-specialty thread with 18 threads on one cannula. I'm going through one entry point, pull that skin taut. I'm going to slide it into the nasolabial fold, pull that skin taut. You feeling okay?
Oh yeah.
Just feel a little pressure?
Yeah, perfect.
There we go. Right up to the nasal ala. Make sure we have it all the way up. Press down, 360-degree turn, and out we go. So we're able to fill in this area with one entry point, and on one cannula we had 18 threads. So you can put multiple multi-specialty threads in the nasolabial folds, in the prejowl sulcus, and in the preauricular area. What I've done here is I've already measured to see where I want my smooth thread on a blunt cannula to enter. I went ahead and I numbed with a little Lido and epi, and you can use bicarb to take some of that sting away. I have a 21 gauge needle now that I'm going to use to make my port. What I'm using underneath the eyes are a 29 gauge 38 millimeter thread. It's a smooth thread. It's 29 gauge 38 millimeters. So I don't know if you can see that, but it's very, very thin and it's short. So we're going to go ahead and insert that into her tear trough. You can also use threads that are on a cannula that are twisted, which gives a little bit more volume. Here we go. We're just going to be right underneath that skin. Super easy to insert. I like to put at least 5 to 10 in the tear trough. These will absorb over time. Her body will break it down. And while it's doing that, it's creating fibrosis and new collagen and elastin, helping to firm up that skin. So this is great anywhere where you're going to have crepey skin, where we have a little bit of volume loss, we're not really replacing volume. What we're doing is we're really helping to thicken and tighten up that skin. It should be right underneath the skin, just so subdermal, just right underneath the dermis. You can also be a little bit in the dermis, just not intradermal. Okay, that's 2 threads already. So the point of having this on a blunt tip cannula, you have one entry point, so you're not having to poke multiple needles into her skin and increase the risk of bruising. So with one entry point, with the blunt tip cannula for the under eye threads, I'm able to put many threads in and help build up that area and tighten up that collagen. These will absorb in about 3 months or so, but the lasting effect can last even longer. All these threads, the lasting effect, depending on their body, depending on the types of threads you're using, you can have the results last for up to 2 years. But your body does start to break them down, and we start to see the peak collagen production at about 6 weeks to 3 months. And this is something that's not one and done. You want to continue to do these treatments to help build up that collagen. So I have created my port with my 21 gauge needle. I've numbed it with 1% Lido and Epi. I'm going to go ahead and take my 29 gauge 38 millimeter smooth thread. It's on a blunt tip cannula, so I'm able to go ahead and insert as many threads as I want through one little port. And we're just going to be subdermal, just right below the dermis, just to help with that neocollagenesis. We're creating more collagen, we're creating more elastin. We're helping to thicken up and tighten up that skin. Okay, just pull the skin taut. Very, very easy to insert. Your patient's comfortable. I'm pressing down, I'm turning 360 degrees just to help get the thread off of the cannula. So you can see how quick this procedure is and basically painless for the most part. All right, just right underneath the skin right there, right into the tear trough. Go ahead and make sure the fontanelle is already pushed forward, press down, turn to help it engage and get it off the cannula. And there you go. Your body's going to absorb this over time. It's going to get better and better. It's not one and done. It's something that you want to continue to do based on how the patient's needs. You can also use smooth threads that are twisted that provide a little bit more volume in the under eye area. We can also make an entry point out here on the lateral canthus and go ahead and make a port, and we can stream these threads in this direction as well. With 1 or 2 entry points, we can fill in the entire area where she has some volume loss in the tear trough area. It'll stimulate collagen over time, and this is something that she can continue to do to help build up that area. We also have the twisted threads that will also create more volume in this area. Just right underneath the skin here, just subdermal, right into the inner canther, right underneath the skin. You can see the tip of it. It's very comfortable for your patient. We're going to avoid a lot of bruising by using a blunt tip cannula. Okay? One of the areas that we have a problem with is that we start to get what's called these waterfalls in the décolleté area. So how we can treat that is with these smooth threads. Place these smooth threads right underneath her skin. These again are 29 gauge 38 millimeters, and we want to have this cross-hatching effect. Now there's many different ways to insert smooth threads. You could have the starburst, the spider web, but really what we want to do is help create some support and volumize this area with the smooth thread. So I'm going to go ahead and go in at a little bit of an angle, just get underneath the skin. It should be fairly comfortable for the patient. When you're in the right plane, it should be very easy to insert. Now these are on needles, so you are going to have multiple pokes. Topical numbing typically works very well, and every once in a while they might feel a little bit of a spicy poke, but if you stay in that superficial plane, they should not really feel too much. But again, they will get some bruising. Go in at a little angle, you're in the right plane, you're going to stay superficial, and you're just going to slide it in. We want to keep these close together because we want that neocollagenesis. If you're only putting in a couple and you're spacing them out far apart, then you're not going to get the desired effect. You really want to create a support system and a mesh underneath of just collagen and that scaffolding effect to help with supporting that area. And these will be absorbed by her body over a 3-month period. As it's doing that, we're getting more vascularity, we're increasing the blood flow and increasing that collagen production, elastin, helping to volumize and thicken up this area. Now, if you're going to incorporate any lasers, you want to space them out because we don't necessarily want to do deep lasers at the say microneedling RF at the same time, because you're going to disrupt those threads. So I like to do all my energy-based treatments ahead of time, allow those energy-based devices to help prepare the skin, and then I'll come in with my threads. But you want to space them out a couple weeks to a month apart. And if you're in the right plane, it should go in very easy. Sometimes the other threads will get in your way and you can remove them. All right, so that's the first batch. And then we're going to go ahead and we're going to cross hatch. Going in at an angle, underneath the skin, very superficial. Now how you remove the threads, go ahead and push them forward, press down, give them all a little turn, and then you're just going to go ahead and remove them all at once. Same here, we're just going to press down, give them a little turn, and then remove them. And she didn't have any bleeding. Okay, this is a multi-specialty thread, and what we're doing is we're building up that jawline. I made my entry point with an 18 gauge needle, and I numbed it with some Lido and Epi. Just pull that skin taut. There we go. All right, so we've built up that angle right there. I'm going to press down. I'm going to give it a little twist and pull out. There we go. So we could put multiple multi-specialty threads in this jawline area to help build that up. We can also place many of them in the preauricular area, and then we can also fill in the temples with those multi-specialty threads. With one entry point, we're able to insert 18 threads in one shot. Okay, so turn. So I've numbed the area with the 1% Lido and Epi. I've got my 18 gauge here, I've got my 21 gauge here, and I'm going to insert a 26 gauge 50 millimeter blunt lip thread. So this we can help evert the lip, give it a little bit of a lip flip, also fill in some of that volume loss, a little bit of collagen production, help tighten up this whole upper lip area. Okay. Okay, this is a 26 gauge 50 millimeter thread. I'm going to go ahead and place it in my entry point if I can find it. Okay, pull that skin taut. We're just going to go into the vermilion border. We want to be subdermal, just very, very superficial. You okay?
Mm-hmm.
Okay. Okay, turn away. So now I'm going to use a 26 gauge 50 millimeter thread to insert into the vermilion border to the belly of her lip and above her lip as well. And that's just going to help create a little bit more collagen production, help to elevate that lip a little bit and give it a little bit more hydration. I've made a, I've numbed the area with 1% Lido and Epi using my 21 gauge needle here to go ahead and make my port. And do you feel that?
No, I do not.
Okay, then I'm just going to go ahead and go right into the skin. Leave that there for a second. Okay, so this is your 26 gauge 50 millimeter lip thread, and it is on a blunt tip, so I can put multiple threads through one entry point. Okay. We want to stay just subdermal or almost dermal, very superficial. Let's try to find our little entry point here. Pull that skin taut. We're going to be superficial. Okay, I'm going to press, give it a little turn, and remove. And we're just helping to restore some of the collagen loss and tighten up the upper lip and the vermilion border and the belly of the lip. Here we go, a little bit definition here. I'm gonna go right in through here. All right, here we go, a 26 gauge 50 millimeter thread. We're going to help to restore volume loss and tighten up the skin and the lip, above the lip. .26 gauge 50 millimeter thread. It's on a blunt tip. I just made an entry point with my port, and we're going to stay superficial and go right into the vermilion border. Keep that skin pulled taut. We just want to be subdermal, and it should go in very easy if you're in the right plane, and it should be very comfortable for the patient. Okay, I'm going to give it a little press and a twist and remove it, and there you go. And we're helping to evert that upper lip, produce collagen, help define that vermilion border, and we can also put some threads into the belly of her lip. We can basically place these smooth threads in a hashtag or in a sundial pattern and really help to produce more collagen to strengthen that skin. So this is also a good technique to use prior to using the barbed lifting threads. If I can prepare the skin and help it thicken up and get more collagen and elastin, then when I do my barbed threads, she'll get a much better outcome. You combine that with your technology-based procedures, she'll have much longer lasting effects. So you can do the hashtag to support the marionettes, hashtag to support the nasolabial folds. You can do a sundial pattern all along the jawline to help tighten up the whole jawline. You can help to enhance the cheek as well by just placing that sundial pattern, or even a hashtag pattern to help support all of the tissue in her upper cheek as well to build up that volume. If you want to support the submentum, again, you can do the hashtag pattern down here as well. So basically anywhere that you can put smooth threads, you can put them in any pattern to help produce that collagen and support that tissue, thicken it, firm it up, produce that elastin, and it'll last them for anywhere from a year to a year and a half, 2 years, depending on how quickly they're aging. So we're offering support to her lower face. She's starting to get a little bit crepey skin, and we're just creating some support with some 29 gauge 38 millimeter threads. And I'm just going to go ahead and use the hashtag pattern to help provide that additional support for her. And she'll start to notice the improvement over 6 weeks to 3 months. And the lasting effects can last up to a year. It is something that you want to do frequently. It's not just a one and done, because we are continuing to age. And we want to stay ahead of the aging curve and continue to build collagen as we're losing it. So this is a great way to support this area. And we're going to stay superficial. We want to stay subdermal. And if you're in the right plane, it should go in fairly easy and should be fairly comfortable for the patient. So what I'm going to go ahead and do now, make sure that all these are inserted. I'm going to press, give it a little twist, and remove them. I'm going to press, give it a little twist, and remove. And there you go. We can expect a little bit of bruising. Our face is very vascular, but over time, this whole area is going to start to get thicker and thicker, and then she'll come and reassess again in a couple of months.